Now we are going to understand about the quadrants of abdomen. So the abdomen is divided into 9 regions by imaginary lines drawn. 2 are vertical and 2 of them are horizontal. Okay, so we are trying to divide the abdomen. Now you see, this is the body of the sternum. Here is the xiphoid process. Now you know this margins where the ribs are attached, right? Now here we have got the costal margins. We have got the costal margins, and here we are trying to draw the abdomen. Okay, and here is the anterior superior iliac spine. Now you know, in the center we are having pubic symphysis. Okay, now here we are having pubic crest, pubic tubercle, that is the pubic crest, and that is the pubic tubercle, what we are trying to draw. This is the pubic symphysis. Now we have got the inguinal ligament. Inguinal ligament is starting from anterior superior iliac spine to this pubic tubercle. If you take the midpoint, please see, this is pubic symphysis. Okay, if you take the midpoint between the pubic symphysis and anterior superior iliac spine, right? The midpoint between the pubic symphysis and the anterior superior iliac spine, both on the right side and left side, and you draw a vertical line. Okay, you are drawing a vertical line which is going up. Then you are getting the vertical planes. These are almost corresponding, roughly corresponding with the mid clavicular line. Now you know clavicle is the collarbone. So these vertical lines drawn from the abdomen, that is the midpoint between the anterior superior iliac spine and the pubic symphysis. Okay, so these are the 2 vertical lines, right and left vertical lines. Then you have got the horizontal plane, the first one, transpyloric plane, and then we have got another plane which is called transtubercular plane. This is called transtubercular plane. Now for us to learn about the transpyloric plane, yes, it is that portion which is passing through the L1, first lumbar vertebra. Okay, and this transtubercular plane, it is passing, through the upper portions of the iliac tubercle. Now you know, when I stand like this, so where am I putting my hand? I am putting my hand on the iliac crest. So the upper portion or the prominent portion of the iliac crest, you get a tubercle, that is called iliac tubercle. So joining the 2 right and left iliac tubercles, when you draw imaginary line, then that is called as transtubercular plane. So please understand, whatever we are learning is just by drawing these imaginary lines, the horizontal and vertical imaginary lines, so that we can divide the abdomen into the 9 quadrants. So if you see in the center, now there is nevus or umbilicus that is present, and this region is called, what is it called? Umbilical region, that which is present in the center. Above the umbilicus, we have got epigastric region or epigastric fossa. Below you have got hypogastric or the hypogastric fossa or hypogastric region. Coming to the right side, you have got here the right hypochondrium. The right hypochondrium. In the same way, here you will have left hypochondrium, right? Here you are having the right lumbar region. In the same way, here you are having the left lumbar region. Here you say this is the right iliac fossa or iliac region. In the same way, here this is the left iliac region or the iliac fossa. So we are having the 9 quadrants of the abdomen like this. Now why are we really dividing the abdomen into so many quadrants? What is the reason? What is the purpose? Whenever we are going to talk about the abdominal organs, these abdominal organs have got a perfect place in the body. In the human body, they have got a permanent and a perfect place in their body. For example, when we say appendix, okay, where is appendix present? Appendix is coming from it's a diverticulum, or it's a worm like structure which is coming from the posterior medial wall of the cecum. The cecum and appendix, where are they present? In the right iliac fossa they are present. This is the cecum, that is the appendix. In the same way, if somebody asks you, where is liver present in our body? Now what you will tell? You will not just say liver is present in the abdomen. That is not the answer what we want. Especially once you are in the medical and paramedical fields, you should tell which quadrants of the abdomen is the liver present. Now you will tell liver is present in the right hypochondrium, extending into the epigastrium. A portion of left hypochondrium occupies also the right lumbar region. Some part of umbilical region, it may extend or it may not extend, but it is present predominantly in the right hypochondrium. This right hypochondrium is monopolized by the presence of the liver is occupying entire right hypochondrium. A portion of it is extending into the left hypochondrium, passing through the entire epigastrium. Also, it is extending down into the right lumbar region. In the same way, if somebody asks you, where is spleen present? Simple. Spleen is present in the left hypochondrium. That's all. That's where you get the spleen. So for this localization of the organs, and for us to refer these organs with a particular placement, yes, these quadrants will be of great help. That's why we are drawing imaginary lines, 2 vertical, 2 horizontal, and dividing the abdomen into the 9 quadrants. Okay, and there is another type of classification of these quadrants where they just draw, 2 lines like this. This is called right upper quadrant, left upper quadrant. This is called right lower quadrant, and this is called left lower quadrant. But that is not that specific. If you divide the abdomen into 4 quadrants, that is not that specific. But this is more specific. Okay, thank you very much.